Conversation with FP Senior Vice President of Research, Dr. Mayesha Alam.
Hi, everybody. It's great to be here with all of you in person, as well as to our global audience online. Thank you so much for tuning in. I'm really excited to have this very important conversation about women's and children's health. A topic that is perennially relevant, often underfunded, overlooked, underprioritized. And to have two really distinguished leaders to join in this conversation is a privilege. So thank you to you both for being here. I'd like to start with just a little bit of level setting to help our audience understand the stakes of what we're talking about. And, you know, since 2000, child deaths have been halved. But the ecosystem that enabled that kind of progress, and in particular the financing of that progress, has shifted dramatically. And as a result, 34,000 women and 1 million children are at risk of losing their lives. It's staggering. And so the question I want to start with to both of you is, why is women's and children's health still underfunded, despite not only the moral imperative, but also the multifold returns on investment that we know can be reaped? So maybe I'll start with you, Kalpana, and then to Professor Osinbajo.
Sure. So why is this underfunded? It is an investment that has incredibly high social and economic returns, but low financial returns, at least in the short term, and low financial returns in any time frame that's relevant for, say, budget cycles or electoral cycles, and that is one of the reasons it tends to be underfunded. But what people don't realize is, it's an investment. It is not often classified as social spending. It is not social spending. It might be, but it is a social investment. And that's one thing. And the second is that even modest investments in this space can yield incredible results. For example, for less than $100 a person a year, investments in robust primary healthcare systems can prevent up to 90% of child deaths. And I just wanted to put a little bit of a finer point on your question, Mayesha. In 2025, the number of children dying before their 5th birthday is projected to rise for the first time this century by just over 200,000. That's modeling that we have put together. And an estimated 4.8 million children dying before they learn to read or write or tie their shoes. This is not okay. This is not okay for a world that knows how to do practically everything. And we have the solutions. It is a matter of will and finance.
Mm-hmm. Yeah, please.
And I certainly agree with all you said. I think sometimes the issue really for politicians is whether this is a vote-catching thing or it isn't. And, it really comes down to that sort of really brutal, if you like, calculation around what will win votes, even in healthcare. Yeah. And there was this, I think until very recently, in very many parts of Africa, it used to be the popular wisdom that healthcare generally wasn't vote-catching. But there was a study by Afrobarometer which showed that aside from jobs, the next most important thing to voters is actually healthcare. Yeah. And especially women and children's healthcare. And that where you had sufficient funding for women and children's healthcare, people trusted governments more, because this is really where the rubber hits the road for most citizens, where they have to go to hospital, their wives or sisters or children are in, need care of one kind or the other. So it is really, I think, now becoming more popular wisdom that it makes perfect sense from the point of view of the politics of it to actually fund healthcare, aside from the obviously, sensible reasons why you must fund children's health care, because really, that's the social fabric, even the economic fabric of
the
society.
country. Yeah.
So.
Well, Kalpana, you really laid out the urgency of the problem, but also a clarion call to say we are not headed in the right direction. We are going in the wrong direction. And I want to come back to you in a minute about what the Gates Foundation is doing in terms of financing and the role of philanthropy. But before that, it's interesting to me, both of you touched on the political aspects of this issue and the fact that this funding is extremely politicized. And, I wanted to come to you, Professor Osinbajo, to pick up on something that you touched on, which is, when you were formerly vice president of Nigeria and other roles that you've held, you've had to persuade others who had very different priorities from very different political coalitions to prioritize and invest in health. And so how did you do that? Can you just tell us at a very high level, how do you persuade politicians to take this issue seriously and to lock in the progress so that investment and prioritization isn't personality driven or based on the whims of any one administration?
I think first it helps, as I said earlier, it helps to let it be clear that it is smart politics as well. Not just, it is great for, practically every other consideration, but it is also smart politics. In Nigeria, we, as you know, have a federal system. So we have state governments, 36 state governments that run their own healthcare systems, and then we have a federal government. So there's always a need to work together to be able to achieve any kind of national healthcare improvements and that sort of thing. So what happened eventually was that we were able to pass a National Health Act. And that National Health Act actually is designed to be a collaboration between federal government, states, and the local governments.
Yeah.
And at the center of that is something called the Basic Health Care Provision Fund, which is 1% from Consolidated Revenue Fund, which is 1% of government revenues. Goes to that fund and is then shared by the federal government between the state governments and the local government. But there's supposed to be some matching funds. In recent times, the present government has done what they call a health compact, which operationalizes the Health Act. So there's a compact signed between the federal and state governments to ensure that the agreements in the National Health Act or the assumptions in the National Health Act are brought to fruition, and which has helped a great deal. So I think the important thing is for governments, first of all, to realize that this is important to the citizenry, important enough for you to be voted out of office if you don't comply. And I think that that's a very strong consideration for those who
maybe skeptical.
For politicians in particular, right.
Yeah. Well, picking up on a couple of those threads, Kalpana, to return to you, I'd love to hear a little bit about how the Gates Foundation thinks about the role of philanthropy and financing, especially in a constrained funding environment where ODA is being slashed, domestic budgets are under pressure, and there are these competing priorities to juggle. How have you all kind of decided to step up on these issues, and how did those investments show up over time, whether that's in labor markets, productivity, economic growth, as we were just hearing about?
Sure. First, I think it's important let me divide my answer into two things. At the Gates Foundation, we have been now for at least 2 years making the point consistently in development cooperation gatherings like this and every chance we get, that not all capital is made equal. There are different challenges that require different types of financing. Just as an example, there's a range of financing instruments that are available to fund a road or an electricity project, a geothermal project, whatever it is. But for some countries and sectors, health being one of them, countries, typically the low-income and low-middle-income countries, where there are few alternatives to public, whether it's domestic public or cross-border public, money for health. And so we have been making that point very consistently, and I'm very happy to say that it's being picked up, sadly, because the traditional sources of funding are drying up, but the point is being picked up that we need to be smart about allocating capital to the right investments based on risk and returns. So that's one principle. The second is philanthropy plays a very distinct role. We can take risks, we can operate patiently, we support work that generates high societal returns, but limited financial returns, we're not looking for returns. So I would say, I think we can help bridge the gap in funding by de-risking innovations. One of the things that the Gates Foundation does is focus on innovations in health. We fund upstream research and development for innovations that will save lives, and then we work to drive the cost of those innovations down so that countries can adopt these in their package of healthcare services, without with much less stress on their budgets. Yeah. You asked the second question about investments and how they work through. I mean, as I said before, it is fundamentally an investment in human capital. And I don't know, some of you might have read a letter that our chair, Bill Gates, wrote to The Economist recently, where he said, investing, he said something about economic growth is fundamentally driven by human capital, and the way to build true resilience is to continue investing in Africa's greatest assets, which are its people. And so I think just understanding that you can have an economy that has all kinds of very high levels of physical capital, but no human capital or very low human capital. And there's countries that are aging, very rich countries that are aging, like Japan, where growth is very low because they have top-notch everything else, and they're a high-income country. So that's the point. It has to be, nothing is going to work unless you have healthy and productive people.
Yeah, thank you for that. We're here alongside the IMF World Bank meetings, and the Gates Foundation has recently made an announcement with respect to the Global Financing Facility, which was designed to align donor funding, domestic budgets, and private capital under a single country-led strategy. And to kind of close out today's conversation, a question for both of you that I have is, what role should international financing play, and what is one structural shift that's necessary to make the dollars go further, the results that much more long-lasting, and to build the resilience that's needed? So maybe we'll come to you first, Professor, and then Kalpana, I'll give you the last word.
I think the important thing is how to scale the work, to scale the resources of countries. And really what has to happen is to see what sort of domestic capital is put up for healthcare. And I think that one of the very smart things that has been going on, and Gates has been able to do that with many countries, and especially with Nigeria, is look at what domestic resources are available and then try and match that, or which I think is crucial, because healthcare responsibility is first and foremost the responsibility of countries. Yeah. And once countries recognize that this is, not just a social expenditure, but actual infrastructure. I mean, this is actual infrastructure for growth, for development. And once it's seen from that perspective, it becomes, if you like, an investable enterprise. And I think for many countries, that's the first step, recognizing it as a major feature of development and growth. And then we can then draw in international capital. Yeah. But first, the countries must, be up to scratch about what they are putting in. Yeah.
Great.
So for me, international financing, and all of us who are in this space, is most effective when it reinforces country ownership and country system and leadership. Yeah. So to Professor Osinbajo's point, it has to be led by countries. And the GFF that you mentioned, it's important because it aligns domestic budgets, it aligns donor support, it aligns multilateral financing behind a single country-led strategy. So it has to, and in doing so, it supports domestic systems, and it basically, I think, is what, I mean, eventually all countries need to transition out of this, donor assistance. And what better way to leave that, to strengthen that capacity than working through their systems to deliver the services today, but then to leave them able to deliver the services later when we are no longer needed.
Yeah, absolutely. Well, if you're interested in this topic, I encourage you, for those who are in the room, to check out using this postcard, Healthy Women, Healthy World. For those of you who are joining us online, you'll be able to see a link on our homepage to this project, which we've launched in partnership with the Gates Foundation, FP Analytics, the independent research division of FP, a series of research briefs and a portfolio of research on a range of topics related to women's health, including one that we're launching this week specifically related to financing maternal and child survival. Kalpana, Professor Osinbajo, thank you so much for being here. We're delighted to have you, and all the best with the work that you're doing.
Thank you. Thank you.